So as I said, my name is Brittany Hamilton Reed. I am a vocational rehabilitation counselor with Michigan Rehabilitation Services. I am located in the Wayne office, but I reside and still work within the Washtenaw County area as well. Sharnessa Williams is also a part of the Job Developers Alliance, who is on this call with us today. And she works through the Washtenaw County Office of Community and Economic Development as Economic Opportunity Manager. We also have some members from the Ann Arbor Housing Commission, some folks connected to the Department of Corrections, specifically the Women's Huron Valley Correctional Facility, and their vocational village program specifically. We also have another provider that she has her own business, but she provides services to MRS or Michigan Rehab Services within Washtenaw County, individuals that go through their programs and more job developing pieces as well. So those are some of our members. And so as you can see, it's a wide variety, kind of touches a little bit of different, various demographics and different clientele. Um, and so our history is a lot of resource sharing. So we meet monthly to talk about the different things that are going on within our community, the different resources to spread to the different clientele and job seekers that we work with. We develop partnerships with different businesses or different agencies or different employers to tap into whatever their needs are, understanding their employment needs or what candidates that they're looking for, so then we can spread that knowledge and resource to the folks that we work with. Um, our biggest thing that we would walk away, or what I want you all to walk away with, is that we are advocates for our specific clientels within the Washtenaw County area, and we are also expanding into the Wayne County area. But our intent is to ideally close some of that gap that exists. We know that, one, working with people with disabilities and understanding their limitations and barriers and what resources that they have at hand, but also thinking about those who maybe gone through the correctional process, or those who are struggling with like homelessness or housing insecurities. Again, tapping into some of those populations and demographics and closing some of that gap related to employment or vocation. We do hold an annual job fair, and we've done so for a while. I joined in 2016, but JDA was established, I believe, in like 2012, I believe. Correct me if I'm wrong, Shar. But it has existed for a while. And the foundation of JDA was to hold job fairs for our specific clientele and the folks that we work with on a daily basis. We work specifically with local employers within Washtenaw to be a part of that job fair, but then also making sure that we held those job fairs specifically in Ypsilanti, just understanding the demographic that live there, and also is typically more accessible for the clientele that we work with. We have within the last year and a half or so, we've ventured into more of a career fair aspect. So still having jobs and employers, but also tapping into training programs. So the goal of getting folks into employment that is provides more longevity. That's not just, a McDonald's or a Meijer, something where they have some training behind their name and they can stay in a role for a longer period of time or move up as well. So that's something that we're doing with as we're planning right now for our next career fair, if you will, tapping into some of those apprenticeships or vocational training programs to bring to our job seekers. So that's a bulk of what we do, and I'm sorry if I'm talking very fast. I know you all have a lot to get through, and I don't want to take up too much time, but that's a lot of what we do, and the folks that we hope to impact. So outside of just sharing who we are and what we do, um, okay. We also have a call to action. As I spoke about the different organizations that we currently already have as part of JDA, we are always looking for other folks to join our organization. As I said, we meet monthly, so it is a lower end commitment, if you will. When we are getting closer and further in the development phase of our job fairs and career fairs, it is a little bit more, but everything we're doing right now is virtual. And then those job fairs or or career fairs, excuse me, are in person, just understanding the barriers that exist with technology for most of our job seekers as well. So the call to action, looking for those who are action oriented partners, willing to hit the ground running and put in the time and the true effort, and not just a part of it just to be a part of it. Looking for dedicated partners that are interested in closing the gap between resources and those historically underserved populations, as well as you are asked that you are here because you desire to be a part of the community and participate and expand our reach as an organization. So again, if you are interested in being a part of JDA, we welcome that. If there are questions, I'll definitely have a little bit of time for that, as well as our contact information to ask any specific questions. Um, but again, our mission or our everything we do is in alignment with employment and closing some of that gap and bringing the resources to those job seekers that we work with. Um, so yes, as I said, we meet monthly, so the third Wednesday of every month at 9 a.m. via Teams. So like I said, we are virtual. Our contact information, email specifically, is on the screen, and I can put it in the chat as well for folks. Um, and then I'll also add my specific contact information. So if there are questions that were not answered today or that you have that are directly related to maybe folks that you're working with or about your organization and being a part, you can reach out to me and I can try to field those questions as best I can. Are there any questions as of right now?
Can everyone see a PowerPoint that says SDOH rollout?
We can see it, Susan.
Okay.
Thank you.
Excellent. All right. Well, a little bit of background is the health system has been doing social determinant of health screening for several years, but only in our primary care offices. So when folks come in for an annual wellness visit, they would do this survey. And it was our intention to roll that out into our specialty clinics. And before we did that, we wanted to do a current state assessment of how it was going. And so what we learned, I'll start with that, is that we're pretty good at asking the questions. We do a pretty good job of documenting answers. We do a pretty good job of referring folks within the health system. And we think we are doing an all right job of sending them out to the correct agencies to help meet their needs if we know where they are. And we do a very poor job of following up and knowing if they got their needs met. We also learned that a lot of our providers, in terms of our physicians or nurses, were ambivalent about having questions with patients about their social determinants of health because they didn't know what resources were available to them. And they felt like there was no follow-up in the chart. So we started out piloting kind of a new program within our specialty care clinics. And one part of that is working with Find Help, which Natalie will talk about in a little bit. But I wanted to kind of describe our current process for folks. And I will say that we've been doing this in alignment with St. Joe/Trinity. I know Shekinah's on leave, so she's not here today, but we have been trying to do a similar process within both health systems and then utilize similar tools so that we can work, I think, better with our community agencies in terms of asking them to also use some of these tools with us. So we call this our PICU, which is our Partners in Care questionnaire. And these are the different domains or questions that we ask. So about child or elder care, help paying for medical care, prescriptions, food insecurity, housing and utilities, intimate partner violence, social isolation, job training, transportation to healthcare, transportation to other things, virtual care. And then the last two questions are just, would you like us to help you find resources or connect you with resources for these? And then, are any of your needs urgent? And we find that about 10% of our patients will answer one of these questions with a yes. So yes, I do have this need. A very small portion actually want us to connect them to resources, but those that we do, we want to make sure that we're helping them do that. And so you can just see here the places that we were asking those questions, the number of patients we asked, the number that would answer yes. So at our Briarwood Family Medicine practice, we asked 12,000, or we have 12,000 patients who are a member of that practice. I think in one particular month, we asked 602 people that question. 85% of them actually filled out the survey with at least one question. Our goal is the 80, at least 80% of patients will answer the questions. And then we keep a dashboard month by month to see how we're doing in terms of asking folks the questions. And then if they are referred either to one of our social workers or care managers who will then try and address their needs. And so in our specialty care clinics, we have a different process, which I'll talk about a little bit today. So in specialty care, people will be asked these questions once, or when they have a significant life event. So like a new diagnosis or a new pregnancy, or a reason that we'd want to ask those questions. And so this is our process that is probably too much detail for the folks on this call, but it's how we go through. So a patient will pre-visit will get asked these questions in their patient portal if they have a portal, or if they use their patient portal. And so they can answer the questions before their visit. If they answer yes to any of the questions and say they want connected to resources, our social determinant coordinator they get all of these questions, and we have a person specifically hired to do this on our care management team called the SDOH coordinator, who gets all the positive screenings, and then we'll triage those to the right place. One of the reasons we like this process is because a lot of times people answer yes to, yes, I have trouble getting transportation to my medical care. So they're not even making it to the appointment. And so if we wait till the appointment to ask them the questions, we kind of miss an opportunity to help them problem solve their transportation before they get here. But we also know that some people don't have access to a patient portal, or the unreliable internet, so on, for a number of reasons, can't complete the form. So if they don't, when they come to their appointment, then they're given that form, either in paper or on a tablet. And then based on the question that they answer yes to, it goes to a different place. So these are our different referral destinations where they're going. So our GAP team is short for Guest Assistance Program, and that's a team of social workers. So they get the questions about skipping medications to save money, food insecurity, utilities, and transportation. And oftentimes they can do something directly to help a patient with any of those. Oftentimes they're just sending them to or connecting them with other resources in the community. And then the questions who will go to a master and MSW for that we will directly kind of work with is the intimate partner violence and social isolation. And those are usually listed as an urgent, at least the intimate partner violence is considered an urgent referral. Social isolation, not necessarily urgent. And then the ones where we don't find that we have a great internal resource, and so we are connecting them to another resource that is perhaps triaging them as in a community. So lack of transportation to getting to non-healthcare related places, childcare and elder care, having a hard time finding work, and then also career training / job training. And then we have a virtual care help desk. And so the ones regarding virtual care are going to that team. This is something that we're actually working on and that we're trying to find more community partners to help us with, is this access to technology, access to internet, and then comfort level with using that technology. So, and not just for virtual care, like virtual appointments, but just we found that a lot of not having access to the internet or a device can contribute to social isolation as well, especially during the pandemic. And then the PFC is our patient financial counselors. So if somebody says they're having trouble paying for their medical bills, that is going to our patient financial counselors. So once we set up this, I'm going to stop sharing for a moment. Let's see. So we created this process, and clearly then the next step is, so when patients have identified needs that we don't know how to meet, our social work teams, probably for decades have been collecting, keeping track of all the different places where these needs can be met, like community organizations, such as many of you all. And so the second part of this process was really making sure that we know where those resources are, connecting patients to them. And then what we want to do next, and what we're just starting to do, probably this meeting is like one of those ways, is making sure we're reaching out to those organizations to making sure we're being good partners. We have a lot of patients who have a lot of needs. There's a lot of organizations within the county. And so as we start to ask more people for their needs, we want to make sure that we are not overwhelming agencies, that we are not sending inappropriate referrals or connections to agencies. And so that's one of the reasons I'm here today, is to kind of talk through that. And then I'm hoping that Natalie has, oh, I see she's in the, Natalie is coming in. So one of the tools that we're using, and Natalie, I see you just joined us. I got started a few minutes early because the agenda was running early. So I've gone through my slides, but I'm talking a little bit about how we want to use Find Help and helping patients and our providers and our social work teams connect patients to resources. And so we started talking about this with St. Joe's and Trinity Health and IHA probably 18 months ago, as to how we could try and work on this together, because we're probably making very similar, our patients have very similar needs, and often they're the same patients. And Trinity Health had started using a tool called Find Help. It's formerly called Aunt Bertha, which is kind of a funny name. I'm guessing that's why they changed it to Find Help. They had used this tool nationwide to connect patients to resources, and they were just rolling it out at the beginning of the pandemic. So they're still kind of going through that process, and we're working together on this. Their lead who's working on it, Shekinah Singletary, is on leave right now, so she's not here with me today, but they're doing a very similar process. And so we had worked with Find Help to try and say, how can we integrate into our EMR so providers could make referrals or find resources directly in the patient chart? How could our patients use it on their own, even if they didn't want to engage with a healthcare provider? A lot of them don't trust us for a lot of reasons, but how could they use kind of a database to find resources on their own? And then in the most perfect world is, how could we communicate back and forth around the people that we're helping? And so Find Help met all of that criteria. And so because Trinity Health had used it as well and we didn't want to do our own thing, we are working on this together. So Natalie's here to kind of describe Find Help. One of the things that I think about is great about Find Help is, so it's paid for by the health systems. One of my first questions was like, so if this is free to everyone, if it's free to community agencies and it's free to patients, like how do they make any money? Are they selling data? Are they selling ads? And it's no, the health systems pay for it. So we pay a monthly subscription fee to have it branded with our logo and to have it integrated into our medical record. And then it's free for everyone else to use. So I think some of the organizations that have found it most helpful are organizations that already don't have robust reporting or don't have online referral mechanisms between each other. And so I'm hoping, and we do want your honest feedback today, that some of you, as you see this, might find use cases for it within your own organizations to either send referrals to other organizations or keep track of how many referrals you're getting from us and so on. So with that, I'll let Natalie show her slides.
Wonderful. Thank you so much, Susan. And before I dive in, thank you all so much for having me here today. As Susan mentioned, my name is Natalie Newbert, and I am a community engagement manager with Find Help. So in my role, I am consistently meeting with nonprofits and organizations like all of you in different parts of the country to teach folks about how to use this tool if it makes sense to you. And so as Susan mentioned, just want to say again, just because I think sometimes this can get a little lost, is that everything I will be talking about is completely free. There is no agreement or contract associated with any of the free tools that we offer to organizations. So just wanted to say that loud and clear. And with that, I'm going to go ahead and share my screen, which always takes me a moment with Teams, so just bear with me. Okay, and Susan, I'm going to look to you. Can you see my screen? The slides? Okay, great.
I can.
Perfect. So I am just going to go through a little bit of background and then spend some time on demoing the platform for y'all to see really how it functions. Oh, I'll just minimize that. Okay. So Susan went over this a little bit, especially in terms of Michigan Medicine and Trinity Health's usage of Find Help, but just a little background on us as a company. Our mission at Find Help is to connect all people in need and the programs that serve them with dignity and ease. And this is very important to all of us because we feel that everyone, no matter where you are or who you are, deserves ease of access to programs and the dignity of a response to their requests made for assistance. And so here is the problem we are trying to solve. We know that it is too difficult to navigate the system of help networks as they exist currently. So this is a problem that I'm sure all of you know all too well. We have individual people, stakeholders, clients, or community members, maybe family members that are searching for resources. And we have thousands of dedicated programs, many of which y'all may help to run or are super familiar with in your community. But the connection process to these programs can sometimes be and is likely a jumbled mess of eligibility requirements, various restrictions, contact issues, and so much more. And that process can look a little bit more like this. A very cumbersome journey of determining which programs even exist to meet an individual's needs, whether they are actually eligible to receive services through that program, and uncertainty about perhaps which documentation is required to receive those services, among a slew of other issues and concerns. So at Find Help, we are trying to make this easier by streamlining the process. And we do this by enabling individuals who are seeking care or those helping them navigate the system. So our Michigan Medicine and Trinity Health social workers and care navigators, we're helping them to search for relevant resources within the individual in need zip code so that they're then able to browse for all available programs and directly connect to those programs through the platform. And then at the final end is that we also want to ensure that those connections receive a response, which I'll go into a little bit more detail during the demo portion. And so just a little bit of background for those of you, Susan provided a lot of really helpful information, but a couple of additional bullet points about Find Help. In essence, we are a free online directory. So I always compare us to Google or Yelp that lists free or reduced cost social services that provide direct services to those seeking help. So this could be anything from medical care, housing financial assistance, education and workforce development programs, and really everything under that social determinants of health umbrella. As I said already, this resource is completely free for those individuals looking for help, as well as organizations to list, claim, and manage their programs. And of special note is that there are at least 1,300 programs available in every zip code nationwide. And some benefits to utilizing Find Help. First, we have an open network that is available in all communities and nationwide. So people interested in finding help can do so anywhere at any time, and they can do so anonymously. So as Susan mentioned, this also means that if you have folks that might come into your organization or you're assisting someone that needs an additional service that you can't necessarily provide, you can also utilize this platform to help them find other services as well. And at Find Help, privacy is at the heart of what we do. And in order to deliver on that piece of our mission, we want to ensure that our platform has the agency to choose when, where, and with whom their information is shared. And for that reason, it's important to note that we are HIPAA and FERPA compliant, and we are HITRUST certified. And lastly, our tool is very versatile and can be used in a variety of ways to best fit the needs of the individual and organizations alike. And we really leave it to the organizations and our individual seekers to choose how they want to best access services and which services can best meet their needs. So now I'm going to transfer over and do a brief demo on how to utilize the platform. But before I dive into that, I would just like to pause quickly. Are there any questions so far? Okay. I'm not seeing any, but if you have any questions, please feel free to put them in the chat or raise your hand. And I think I'll be able to see that on Teams. And if I don't, I am so sorry, but I'll pull up the chat periodically. Checking in, can y'all see the University of Michigan Health Find Help? Okay, great.
Yes.
So for those of you that have never seen it before, this is University of Michigan, so Michigan Medicine's branded version of our site, as Susan mentioned. I'm just going to show you what our Find Help site looks like. They're pretty similar, but as Susan also mentioned, Michigan Medicine has customized their site to best meet the needs of the community that they're serving. However, at a baseline, as you can see, these are pretty similar. So depending on where you log in, you're going to still start off with a zip code search here. But a few other things to note before doing that. I want you all to notice that I am not currently logged in. So we're going to start off by just looking for services. And again, I can do so anonymously. So this is not only free, but I don't have to create an account or anything like that. Second, all of the pages on our website, you're able to translate into over 100 languages powered by Google Translate. I just want to acquaint you all, that button is down here. So I could choose whichever language I want. And then I would click this teal arrow and the page will be translated. Lastly, for those of you that do help to manage or run programs, you can suggest programs if they're not currently listed through the suggest button down here. And then you can also claim programs through this button here. And I'll go into a little more detail on exactly what that means in a moment. So if folks wouldn't mind, I'm going to open up the chat. If someone could just either call out or put a zip code for me to use as an example in the chat to kick us off. Perfect. Thank you, Catherine. So we're going to do 48104. So I just put that zip code in, and then I'm going to click search. Actually, I'll keep the chat open. So then I'm brought to this next page, which is going to show me, as y'all can see, there are 2,223 programs available to me in this general area associated with this zip code. Not sure if that number may seem small or large to you. Regardless, we always include local, statewide, and national programs in each zip code search. And that is primarily for more rural parts of the country where they might not have access to as many local programs. We want to ensure that we're also bringing up national programs that those folks would have access to. So then if I'm searching for programs, either as an individual or perhaps I work for a state agency or a nonprofit, and I'm trying to find services for a community member, I can either use these category icons, and as I scroll and hover my mouse over each, it's going to show me subcategories. And then the number in parentheses is the number of programs available to me in my zip code in that category. So I can use these to hone in on my search, or if I want to put a keyword or a specific organization or program name up in this search bar here, I can also do that. One other thing to acquaint you with is that that translation option is still available. It's now just moved up to the left side. And I see we got a question in the chat. Jim asks, is there a way to assess when the local helping organizations are underfunded and therefore unable to help? Yes, and we will get to that. And I'll show you where that will show up. Is there a specific category, icon, or keyword that someone would like me to use in our search? And you can holler out or put that in the chat. Housing, perfect. Thank you, Nicole. So I'm going to go up here, so I could either click on housing here, or I can type it in. And I'm just going to click on this keyword search here, and then it's going to bring me to my next page that shows me all of the different programs that are tagged as providing housing services. So a couple of things here. There are 236 housing programs available in my zip code. That might be a little overwhelming for me. So I can further narrow my search using these various filtration options at the top. So I can either choose personal filters. So we recommend that folks typically choose one or two of these. But for example, I could choose if I need housing with, I'm housing with children or my age group or if I'm a veteran. I also have the option to narrow my results by program filters. So if I need to, how do I want to get in touch with that organization? And what are their hours? Also, everything listed on our site is free or reduced cost. But if I specifically, for example, might need a free program, I can denote that here. And I can also add in a language preference. So I'm going to filter my search by just free options, and we'll see what comes up. And that cut us down a little bit to 172. Lastly, then I can sort by relevance based on these filtration options, or closest, which is geographic proximity to that zip code. Now, if I scroll down, first I can see where some of these programs are on this map here. And then I see a bunch of these white boxes populate. And we call these program cards. So each white box represents a different program. So let's take a peek at this University of Michigan Housing Counseling Program. So Housing Counseling is the program name. University of Michigan Housing Bureau for Seniors is going to be the organization. I can then see when this listing was last reviewed. That it means either by someone that works for that program or by our data team. And then I'll see a very brief description and the main services that this program provides. Then I'll see who this program serves. And if I need some additional information, I can click this More Info dropdown and see a lot more information about this program to help me determine if this is right for me. So I'll see if there are eligibility requirements for this one. This is for seniors. And then this availability, circling back to Jim's question, when you go in and manage and edit your listing, you can update the availability. And there are a few different options you can choose from. I believe there are some that say wait list, near capacity, at capacity, temporarily closed. And if you choose anything other than available, that will show up in red bold font up here so that folks searching for services, either seekers or navigators, will see that immediately. I can then see language, cost, next steps, coverage area, and then I can see locations and hours as well as this map. A few other things to note, and we can compare these two program cards here. On this housing counseling card, y'all may notice that they have both this little check and this little ribbon icon. So if I hover my mouse over the check, the pop-up is going to tell me that this program has been claimed by University of Michigan, HBS. And so they are helping to ensure their information is accurate and up to date. And that check mark, meaning claimed, means that someone from that organization has gone in, they've created an account, which is also totally free, nothing associated with that. And that allows them to then go in and edit and update their listing as needed. And we add that check mark to let community members, social workers, whomever's utilizing the site know that someone has gone in and is editing this listing, because we believe that that means it is likely more accurate than perhaps a listing that has not been claimed. This listing or this organization has also become certified, which we can see by this little badge here, which means they have taken our 101 and 201 webinars on how to utilize the site, and they have taken the quiz, which means they are certified and they are extremely familiar and well-trained on how to use the platform. We add that badge also because we want folks to know that these folks are more likely to respond to folks that are reaching out to receive services. I'm going to pause. I have a couple more things to show you all, but any questions so far on claiming programs, program cards, searching for programs, and using the different filters?
I have a question. Can more than one person claim an organization? So like say that the case managers at my organization as well as our director wanted to be able to access and change the information on here.
Absolutely. And that's such a great question, Catherine. I appreciate you asking it. As many folks at your organization can claim a program card as it makes sense for you. And so highly recommend having multiple folks claim, just so, as we know, over time, people leave organizations, some folks stay, but it's just better to have more people that are trained and understand how to update the program cards and that have the capability to log in. So as many folks as you want can claim the program card, and I'll show you more in depth how to do that. And I'm also happy just putting a plug to connect with anyone via email or in a separate meeting as well to go over that in more depth for your specific program. But yes, unlimited number of folks can claim a given program. Any other questions?
I guess a follow-up question to that also is then how do you ensure that the people who are claiming these organizations are actually the people who work at the organizations?
Another amazing question. So I'll show you all if we don't mind diverting, because I do think claiming is really the first step. And once your program card has been added, the first step so that you have access to edit and update your listing as needed is claiming. So I'm just going to go divert really quickly. So this would be the same on the Michigan Medicine site, but on any Find Help site, actually I am going to use Michigan Medicine's site. So let's say that you want to go and claim your program. So you can do that. I'm on uofmhealth.findhelp.com. In the bottom right-hand corner, there's this Claim Programs button. So I'm going to go ahead and click that. And then first I'll type in my program name. So I'm just going to use YMCA as an example. And I'm going to use my zip code. And then I'm going to click Get Started. So you would do the same process just with your program name or organization name and your zip code. And then it's going to show me all the different programs in my area. And I will choose the one that is my program, and I'll click this claim button here. It's then going to bring me to this next page that's going to bring up all of the programs that are associated with that organization. So Catherine, for example, I'm not sure which agency or organization you work with, but if you had multiple programs listed, you could then claim all of them or just one of them, you know, whatever made sense for you. And then you're going to click I work here. And the next page is then where you'll create your account. So you would add in your first name, your last name, and your work email address. And so this is how we verify that you actually work for this organization. If the domain of your email does not align with the name of the organization or program, so in this example, YMCA, it takes our data team a couple of additional days to do some background checks and reach out to you to ensure that you do actually work for the organization. If the email domain lines up with the organization or program name, the claiming process is usually pretty quick, within, I would say, anywhere from 10 minutes to 24 hours. And if it does not pop up, always check your spam and reach out to me. But typically that is how we verify, is by checking on the email domain. And while we're thinking about that, you'll know that you've claimed fully. When you follow the prompts, you'll receive a follow-up email. And when you go and you log into uofmhealth.findhelp.com, you'll see this My Program Tools at the top of the page, as well as this dashboard here. And that's how you know you've successfully claimed. Any other questions so far?
Natalie, I'm trying to take a stab at answering Jim's questions, because HAWK is our centralized intake for housing services. And so a lot of those programs that were listed, like Avalon or would all go through centralized intake. So it's like maybe a more complex question. So I'm trying to work on how to answer that one for you, Jim. I think Natalie, in this case, if people don't take direct, or agencies don't take direct referrals, it's probably under that see next steps that would say either connect the organization or connect to HAWK.
Yeah, and I know I only have a little bit of time today, but if folks are interested, happy to set up another meeting as well to really dive deeper, or individual meetings on how you can customize your program card. So this teal button, as you asked, Jim, this denotes how that program wants to be contacted. So we can see for the HBS program here, they have the See Next Steps option turned on. So that it recommends that I call this phone number to get in touch with them. Whereas the Fisher House, Michigan actually has a one-step referral turned on. So if I click contact here, it's going to bring me to this basic referral form that I can submit directly through the platform to them. A few other options, I'll see what we have on this page. They're pretty much look like mostly see next steps. We also have an external apply option, as you can see here, for Little Mary's Hospitality House. So some organizations may have a screener or application form or something of that nature already listed on their website. And if they already like the way that workflow is going for them, they can link that here. So for example, if I click on this, it then asks me to go directly to their website, and I can fill out this application that is here. A few other things, just being mindful of our time today, that I wanted to call attention to. For those of you that are referring folks out potentially to other programs, or if you have someone come into your office and perhaps they've asked you if you know of any housing services in the area, and we'll just use this as an example, you think this HBS program is great, and maybe this Fisher House, Michigan program could be good as well. You have a few ways that you can share these with them. So first, you can click on this share button here, and you're able to send out this program card, so all of that information to the individual by email, text, or you can share on Facebook. You can also print resources. So you can do that by clicking on this check mark here. So if I wanted to share multiple, I can click multiple, and then I'll go down to where it says to selected, and then I can email or print them. The other, and if you ever notice that there's some inaccurate information on a program card, you can also use the suggest button to submit a suggested change to that program card. And we highly recommend doing that if you ever see programs that you're super familiar with, especially if they have not been claimed, just so we can ensure we are giving as much accurate information as possible. A few other functionalities I wanted to show you all, and I know this is a lot of information. So again, I will put my email in the chat for folks to reach out to me afterwards as well if you want to schedule any additional time. But as Susan mentioned, we also have the capability to send and receive referrals through the platform. So depending on your existing workflow for your organization, if that may make sense for you, I'll just show you quickly how that could function. So for this, I'm actually going to navigate over to my demo platform. I don't want to send a fake referral, and show you all what that would look like. So these are all fake programs solely used for demo purposes. So as I can see on this employment training program card here, they are claimed and they have a one-step referral turned on. So let's say that I work for Michigan Medicine and I'm referring a patient to this employment training program. I would click refer, and then I get to that same basic referral form we saw on one of the other program cards. I'll then choose whether I'm referring on behalf of myself or a family member. And in this case, I'm referring on behalf of one of my patients, so I'll click the someone else option. Then I'll put in my patient's information. This is also not real information. I'm only required to put in their email or phone number. I'll add in their language preference, the best way to get in touch with them, which I know for this patient is going to be email. We also have the option for don't reach out, which is recommended for safety, public safety reasons for some patients or community members. You can add a comment that will be received by the program. And then at Find Help, we have a per referral consent model, meaning that I have to confirm the consent of the individual I'm referring on behalf of on every referral I make. So even if I am meeting with Sunny weekly, I refer on their behalf all the time, I still have to confirm their consent on this specific referral. And then I'm going to click send. Send. And when I click send, three things happen. First, Sunny, the patient, receives an email confirmation that this referral was made on their behalf. Second, the Michigan Medicine social worker, myself in this case, would also receive an email notification and be able to check up on the referral and the people I'm helping dashboard. For those of you that send referrals as well to other organizations, if you used the platform to send a referral, you would also be able to track and manage those referrals with your team through this dashboard. And finally, the program or organization that has the one-step referral turned on would also receive an email that this referral was made by a Michigan Medicine social worker. And that email, I'm going to pull it up. I wonder if it'll let me show you. Do y'all see the email or no? No.
No.
Sometimes, let's see, I might have to screen share. 1 second. The email would look, now can y'all see? Yeah, okay. The email would look something like this. So it would say, hi, program or organization name. This person referred someone to your program. Here is their information. And it would bring you these buttons as well. So you could directly respond to this referral through the email. And we have this as an option because we know how busy our nonprofit and organizations are. And we just want to make this process as easy and seamless as possible. So you could click one of these buttons here, and that would automatically send that referral response to both the navigator and the individual in need of services. Finally, you as the organization, if you chose to turn on the referral tool, would also be able to manage and track those referrals made to your organization through your inbound referrals dashboard, which I can find under the My Program Tools. If I click on inbound referrals, take a moment to load, I would have a different folder for each of my programs. And I could click on one to see all of the referrals made to my program and check on their status, see who is in need of services, who they were referred by, the date of the referral, when this was last updated, and I'll also be able to view this person's full profile. Furthermore, I can also update the status of the referral through this dashboard. And if I updated it through that email, that would automatically be updated here as well. Any questions on that one-step referral process? So I know this is a lot of information that I just shared, and I have to hop off in a couple of minutes. So I'm just going to navigate back to my slides here. And I did want to take some time if there are any additional questions for folks. And then I'll also just leave my contact information in the chat.
I have a question.
Absolutely.
Because I joined late for this website. Which one is this? Findhelp.org. Is it easy to just sign up, or do we have to have permissions? Or
it is super easy. So I'm actually just going to stick this link in the chat for y'all. So if you have programs or services, you can either suggest them or see if they're already on the website by utilizing this link here. And if your program is already up there or already listed, you can then go ahead and claim it. If not, you can go through the process of suggesting. It's pretty quick. You'll fill out these prompts here. Then it's going to search to make sure that the program isn't already listed. And then it'll ask you for a little bit of additional information. And once it's added, our team will send you a link and then you can claim it. But that's all free, Krista. There's no contract or anything you have to sign associated with it. All completely free to use.
thank you.
Mm-hmm. Any other questions? Well, if not, a few next steps I'll just highly encourage for anyone to take if you have the bandwidth at any time are, of course, first making sure your program is listed and claiming it. And we'll be sure to send up some follow-up information with resources on how to do that. And lastly, I'm going to add in my email into the chat. And Susan also and I are always in contact. So you can contact either of us and we're always in each other's loops, but we're happy to meet with anyone and everyone if you have any additional questions or want more information or want to troubleshoot anything going on. And we also offer some monthly training. So y'all pretty much did a kind of hyperspeed 101 training today. But if you're interested, a really great next step too is we have monthly 201 trainings, which do a deeper dive into the free suite of tools that you'll have available to you once you go through the process of claiming. And those tools include editing and managing your listing, the inbound referrals dashboard, and we also have a suite of free analytics and impact reporting, which can be super useful for presenting to boards and applying for grants and things like that. So please let us know if you're interested. We'll send out that information, but really grateful to y'all for listening in today and having me in your meeting.
Thanks, Natalie.
Thank you.
Thank you, Natalie. Jennifer, whenever you're ready, you can go ahead and do up your presentation.
Okay. Is everyone able to see the first slide?
Yeah, we can see it, Jennifer. Thank you.
Okay. Just so I know, do you see additional slides and notes on the side? This works just a little differently than PowerPoint presentation, so.
I'm not seeing them in my view, but I know there's a view where you can.
Okay, yep, no worries. Well, thank you all so much for inviting me here, and thank you, Ambrose, for your patience with my wild schedule these past couple of months. I am really grateful to be here. I am the Behavioral Health Program Manager and one of the therapists at at Corner Health Center in Ypsilanti, formerly of Corktown Health in Detroit, Michigan. Originally, when I was approached to speak about LGBTQ issues, I wanted to make sure that I could provide folks with something that was a little different than your kind of average just kind of 101 overview. I anticipate lots of folks have had maybe very basic introduction to some of these ideas. And so I was hoping to give you something that was a bit more specific and timely, especially since I think right now transgender health issues are very much in the news, and a lot of our clients are seeking care and also asking us questions about what services we offer, if we should be offering them, and so on. So I will kind of move us forward here at lightning speed, and hopefully we can get it all in today. I have no disclosures to share with you today. I have a few guidelines for our presentation. I am a social worker, and so anytime I talk about these kinds of concepts, I want to be sharing with people the idea that I'm assuming everyone that's in this meeting today is here to learn and to share the resources that they have, that we're all teachers and learners. And so if you have questions that you want to ask, please feel free to do so. No one will kind of get at you for asking a wrong question, or if your question comes out in kind of an inarticulate way. I will be sure to let you know, perhaps, what is problematic about a question, so that you don't ask that same question of your clients in the real world. But this is a learning space, so this is an okay place to do that. And that's why I'm here. I ask folks to kind of speak from their own experiences, to share about the experiences that they have with their own clients, and I'll do the same, as opposed to, maybe passing on information that like, I heard that all people who are like this do these things, right? So those kinds of stereotypes, not super helpful to us in these conversations, but kind of direct client interaction is. Most importantly, of course, take care of yourselves. I anticipate I may run a few minutes over today, so if you gotta go, you gotta go. I will not be offended at all. So just a couple of items for us to look at today. I'm really going to zero in on reviewing trans spectrum related identities today. And we're going to learn about elements of offering services. So whether those be healthcare services, housing services, or any other kind of community-oriented service in a way that affirms people and affirms their gender. I'd love for you to learn some new skills about talking to and about serving transgender clients. And then also I will share some resources with you so that you can continue practicing these skills on your own. Just kind of starting us off, our first big question today is, what is gender? And kind of how is this different from another concept that is associated and sometimes entangled, which is biological sex. One definition, and the definition I think similar to one used at the University of Michigan and a few other organizations, is that gender is a constellation of traits. It includes things like behavior, psychology, our culture, and it's typically associated with one biological sex or another, but it's not necessarily the same thing. Gender is also different from another concept, which is gender identity, which is kind of an innate personal sense of a person's gender. It's our own self-concept. It may or may not correlate with the biological sex that a person would be assigned at birth. And it tends to be things that we can express or use to express our gender. So things like clothing, our style of dress, the way we talk, our social mannerisms, as opposed to that biological sex, which is a medical term, right? It's typically recorded in a binary way. We think about male or female, and that's usually based upon reproductive function. But those of you who are working in medicine and healthcare may know, of course, that that binary does not exist in the way that society kind of thinks about it. So we'll get into some more of that. This slide is a good one for approaching these concepts for the first time. This is what we call the flying gender unicorn. It's meant to be representative of those few different concepts we just reviewed. So gender identity and gender expression, as well as the biological sex assigned at birth. And it has lots of interactions with other things like our actual body configuration. So for example, what our genitals or what other secondary sex characteristics may look like. So things that we can see on the body. It may have some relationship to things like hormone levels that in the body that vary over our life cycle, and also something like chromosomes, which are fixed and which do not change over our life, but also which are microscopic and which we can't even see. Most of us don't know anything about our chromosomes unless we have specifically had some sort of gene testing, either for illness or because we are having difficulty with reproduction, something like that. So many of us kind of have no idea what's happening for us at a chromosomal level. Okay. I do include links, if you'll note, just on the bottom of the page. In case you find any of these really interesting, I will send the slides out so that you can see them and review them at your leisure. Two big identities that I want to make sure we get to today. Again, these are kind of being focused upon in the news and in public policy right now, so I want to make sure you have a great framework for them, are the idea of cisgender and transgender identities. So cisgender individuals are people who have a gender that corresponds to the biological sex they were assigned at birth. So for example, a person who is assigned a female at birth and now identifies as a woman, or a person who is assigned male at birth and now identifies as a man. So for those of you who maybe have a chemistry background, you might recognize the prefix cis which means on this side. So that's maybe a helpful reminder, a way that you remember this, that cis means, same side, that a person's assigned sex and gender identity kind of line up, right? This is in opposition to trans identities. So transgender individuals are people whose gender identity does not correspond to the biological sex they were assigned at birth. So for example, that might be a person who was assigned female at birth and now identifies as a man. That might also be a person who was assigned male at birth and now identifies as non-binary. So not in a binary way, but in a way that is different from or does not correspond to that biological sex they were assigned at birth. And then same idea with that chemistry prefix. We think of trans as meaning across in Latin. So you can think of the biological sex assigned at birth and the current identity as not aligning, if that makes good sense. I was really excited that our previous speakers were talking about social determinants of health. That is the big why of why I'm sharing this information with you today. That all of these factors that we know impact people's physical health outcomes, their mental health outcomes, even their kind of socioeconomic health. All of this stuff is kind of disproportionately impacts people who are vulnerable, and that includes transgender individuals. That health outcomes are poorer, mental health outcomes are poorer because of the experiences that trans individuals might have over their lifetime, right? So all of the things that we might normally think about, stuff like discrimination, stigma, having human rights violated, being harassed, but also things like provider rejection. So in a healthcare setting or in a community setting, like the ones that we serve, our inability to serve and affirm individuals is often, kind of feels like rejection or is actual rejection, even if we don't mean it to be. And that contributes to poorer health outcomes for people. So this is the why. This is the really, really important reason that we're having these conversations today. Another important concept I want to touch on is the idea of multiple marginalization, that, transgender individuals, just like cisgender individuals, are not a monolith. All folks are different, and all folks have different kind of backgrounds and intersections. And those individuals who have more kind of connection and marginalization in vulnerable communities tend to be more impacted than individuals with fewer. So a person whose other identities might line up again with poverty, having a lack of access, disability, things like that, in addition to a trans identity, might be more impacted by these social determinants of health. I also want to get to exactly what affirming care or services look like. It means something different in every practice setting, but in general, these are some of the things that my organization and other orgs who kind of specialize with this population recommend. So looking at things like forms, assessments, and intake paperwork that are inclusive so that they capture all different relationship styles, all different identities, and spaces that are accommodating and welcoming to all different kinds of people. The idea that all of your staff need to have just even very basic LGBTQ knowledge so that your patients are not spending their time teaching your staff about their identities and relationships, and they can actually get the services that they're there to receive, right? We need people to feel accepted and understood, and not just tolerated in these spaces, because of course people can tell the difference and they won't return to organizations where they don't feel accepted. It's also really important that we are providing services, whatever those are, free of judgment, not only because we most of us are charged with doing so as a social worker, as a doctor, other kinds of public servants, people who work in housing organizations. Of course, we are charged with providing bias-free services. And finally, we want to make sure that care is appropriate, that it is tailored to every person's individual need, as opposed to just kind of like a blanket, here, yeah, everybody kind of gets what they get, right? That we are shooting for equity for people and not just general equality, right? There are lots of different ways to provide affirmation in spaces. These are some visual indicators that I share with people because these are really, really easy to do. You can add posters, magazines in your organization, brochures on the walls that include diverse images. So different kinds of people are represented in that media, and that's very, very important. Some of you might have heard the idea before that folks need to see someone like them when they walk into an organization. If your organization doesn't include individuals from all walks of life, you can kind of broaden that reach by making sure that those images are represented appropriately. So showing that your organizations have affiliation with LGBTQ supportive organizations, putting it out on your social media, posting your anti-discrimination policies in a place that it's easily acceptable for folks to see. Most of us are supposed to have those posted anyway, so make sure they're nice and big and make sure they include things like freedom from discrimination due to sexual orientation, gender, and gender identity. Finally, individual public servants can wear lapel pins or ribbons. Some of us have lanyards or pronoun pins. I was going to say I like to show people I have a little pronoun pin on my badge. Oh, you probably can't see them because my screen is blurred, but it is so simple. I put that on my badge and it's just there every day. I don't have to do anything else with it, but it automatically shows as a representation to clients who walk into my organization that I'm a person maybe that they could trust to share some of that information and know that I'm going to be able to handle it, if that makes sense. I wanted to give you an example of forms, but I apologize. I know that this picture is tiny. It's very, 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 very hard to read. I will send those out so that we can blow them up and folks can lay eyes on them kind of individually. This image was lent to me by a fellow social worker at the University of Michigan in the HIV clinic. She overhauled all of her organization's documents to make sure that all of the paperwork had open-ended questions, so not just check boxes, right? But a place that clients or staff can write in information about clients. So we should be asking open-ended questions, right? We should be asking, like, what is your relationship status, as opposed to a checkbox that just says married or single. We should be asking folks, what's the name that you go by? What would you like me to call you? As opposed to just tell me what your legal name is, right? Lots more options if you must have check boxes. I know some of us use like health records, or maybe we have a form that's been given to us by a state agency or by a grantor where we have to use what they have given us, but it is your use of that tool that really determines what is affirming, right? Even being able to say to a person, hey, I know this isn't a lot of options. What would you be most comfortable with me putting down? And also, is there something that you want me to write just over here in the sides and the margins so that I know the proper way to address you and my staff knows the proper way to address you when you come into my organization? I have a video to share, but we don't have time to get to it. I'll make sure that that link goes out. In fact, I think, whoop, I can't clip it right out of there, but I will send you the link before we leave today. It's a very, very cute video. It was put out by the LGBTQ Cancer Network, and it's called Vanessa Goes to the Doctor. It's an example of an affirming practice space, kind of contrasted with one that is not very affirming at all. It's very cute. It looks like one of those 1950s like healthcare videos, if you've ever seen those in black and white. So I will make sure that that link goes out as well. It's only maybe 10 minutes long. It's really cute. It's a fun one to watch, and please feel free to share it with your staff. Thus far, the folks that I have shared it with have found it to be pretty eye-opening. I do have some additional information to share, but I do want to be respectful of folks' time. Some of the other information I have prepared for folks today is a little deeper dive into cisgender and transgender identities, some of the language that we use in affirming care, and then also some ways to practice using proper pronouns, using folks' chosen names as opposed to just a legal name for our clients, and some other information like that. I would be happy to go over that if people want to stick around. I'm also happy to come back and share this with people in the future, or to provide individual training to any of the organizations here. That is something I'm happy to do, and my organization is happy to make available. So maybe we will pause there for now, just to see if people have any questions. And okay. There we go. Just any questions, concerns, anything folks might want to know more about, maybe for a future presentation. Seems like everybody is an expert, which is great. That's the result that I'm looking for at the end of every presentation. Folks know everything. Good. Okay. Again, if you'd like to see these slides, I will make sure that I provide Ambrose with an appropriate copy to send out to everyone. And if folks have additional questions, you are more than welcome to contact me directly. Yeah, but that's all for me today. Thank you.
All right. Thank you so much for coming in, Jennifer. And a big thank you to all of our presenters. I don't know if all of them are still here, but thanks everyone for hanging in there today. I would love to have you back, Jennifer, just to get some more in-depth stuff, but you tell me when that fits into your schedule, but I will definitely get the information out there.
Thank you so much. I really appreciate it.
All right, with that, I'll go ahead and adjourn. I know it's not as formal as we usually are, but it is 3:01. So thank you guys so much for your time. You have a great afternoon.